Welcome, PAC members, to our August PAC event. Hi, I'm Jocelyn Yadiad. For those who don't know, I am one of the project managers with the Dog Aging Project station at Texas A&M. Now, today's event has been pre-recorded, so if you have any questions, comments, concerns, you can always email our team at team@dogagingproject.org. Now, today's event is going to be an awesome one. Today, we're meeting, well, you get to meet Dr. Janice O'Brien and get to learn about her amazing work that she does here at the DAP. She's a veterinarian who's now working on research, and we're really excited about that. But before we get started, quick little updates about what's happening here at the Dog Aging Project. As always, we have a few more publications that have been released. You can check out all these awesome publications on our publications page at dogagingproject.org/publications. It is one of the tabs, and go explore. We've been slowly updating our scientific blog posts. So all those publications, we try to make it more known for the everyday person like me to understand our scientific results. So you can also check out the scientific results series on our blog at dogagingproject.org. And last but not least, we are still openly recruiting for our triad cohort. So for those who know any older dog that weighs between 44 pounds and 120, please send them our way. You can spread the go to our project resources page, download the resources and spread the word, or just send them to our website. The more the merrier. Now, without further ado, welcome Dr. Janice O'Brien. Dr. Janice is a veterinarian who's also a researcher with the Dog Aging Project. And today she's going to talk about her awesome work. So, Dr. O'Brien, when you're ready, take it away.
Yay. Thank you so much for that introduction. Yeah, and I'm really excited to share some of the research that I've been able to do with the Dog Aging Project data. And this particular work was focused on doing like a really high level examination, like not getting into all the nitty-gritties, but just kind of going, are there differences in environmental exposures and then health diagnoses among dogs living in different regions of the US? And so preliminarily, like I think, people expect that there probably are different exposures that occur in different regions. If you have lived in multiple places within the US, you've probably experienced these differences yourself. Like I've been in multiple different places throughout my life, and I feel like living in Texas was a way different experience compared to living in Virginia. And people that live out west versus in the Midwest, like there's just so many different, not just weather variations, like in terms of temperatures, but like where are a lot of farming activities happening versus and what types of farming activities those are versus like what are the things you're going to get exposed to? Are you going to get ticks when you go outside for a walk? Do you have a lot of woods? Do you have a lot of like open kind of like prairie land around you? Like the different regions of the US seem different. And we even have some preliminary data that we did on a different project within the Dog Aging Project, just looking at dietary choices. So what Dog Aging Project participants are feeding their dogs. And this was the percentage of each state that was feeding kibble. And you can almost see like there are regional differences, state-based differences in the percentage of dogs that are eating kibble as their primary diet. You'll notice that a lot of central states tend to be higher percentages of dogs eating kibble as their primary component versus like your more coastal states tend to be feeding it less commonly as the primary diet component. And then personally, I just as a veterinarian noticed that my practice was shifting based on where I was located and where I was practicing. So when I graduated from vet school and started practicing, I was in Texas, and I just remember there being so many heat injuries. Like that was just such a common thing to have somebody call and be like, so-and-so's on their way. Their dog was, very, very hot. They need to come in to get, emergency heat treatment. There was also specific disease called Chagas disease that can affect heart heart tissue. And so we would have to do a lot of Chagas screenings, do like EKGs for the dogs. And then I also just noticed that when I was there, because I went to vet school in Indiana, and at that time there was like this miracle allergy drug that had come out, and it was like helping all these dogs that had just had the worst allergies that just didn't nothing seemed to work for them. And it really was. It seemed like it just fixed all those dogs, except that when I moved to Texas, that miracle drug didn't even seem to work for all the dogs in Texas. So I just personally felt like allergies were so much worse there. But of course, anecdotes are, individual experiences need to be studied, at a higher level. So it's not just, Dr. O'Brien and her thoughts of what she thinks are different, but are these things actually different for different veterinarians across the country, and how are dogs being affected? And as a counterexample, when I moved to Virginia, the heat injuries definitely seem to go down, and Chagas is definitely not common, but Lyme disease was just so bad here. It's just a different, it's a different beast. So this is a map of the United States and the prevalence of Lyme disease. So of course it makes sense that it was way more common in Virginia compared to in Texas, but it's still, when you see it every single day, it just you experience it differently. And so when we did this research with the Dog Aging Project data set, we looked at the initial surveys that people completed upon enrolling into the Dog Aging Project. And so that was, at the time, it was 47,444 surveys. And they were from enrollment dates that ranged from 2020 to 2023. And so what we did is we took the primary state of residence information, and we used that to group the dogs based on where they were living the most of the time. And so we split those into basically just the census regions. Like, yes, we could have done it based on the 50 states, and it probably, like, if future studies should, when you're going into the more nitty-gritty details, should do that, because look, Virginia and Texas, which are so completely different from each other, are still grouped into the same census region. But this made sense to us just based on hey, we're just trying to look to see, are there actually differences in these things? And we're looking at like 143 different variables of exposures. So we just want to get a preliminary look at what things do vary, what things probably are not varying as much, and just test and see whether or not they are different from each other. The types of variables that we were looking at were basically everything. It was indoor exposures, outdoor exposures, and activity related exposures. So for indoor exposures, we're talking about everything the dog might be breathing, everything the dog might be touching that's indoors, because dogs are interacting with their world much in the same way a toddler interacts with their world. Their feet are touching things, their mouths are touching everything. So I wanted to know, variations in surfaces, air quality exposures, like if people are burning incense or candles, or if they have air purifiers to remove things from the air. Also, do they have air conditioning or heat? Is it a central or window unit? What type of stove do they use? Is it an electric stove, or is it like a gas stove that might be putting particulate matter into the air while you're cooking? In terms of outdoor exposures, everything that is like, what types of animals might your dog be interacting with, or even if they're not directly interacting with them, are they somehow exposed to just the animals being in the same sort of area? So is that wildlife? Are they farm animals? All the different surfaces that are outside, so asphalt versus concrete versus astroturf. And then water exposures. So if your dog is going outside and swimming, or if they're even like drinking the particular water, but if they're swimming, is it in a stream? Are they swimming in the ocean? Are they swimming in an agricultural ditch? If they're going for walks, is it on or off leash? Because, in terms of activity, we're trying to think about, the sort of questions in the future that people could ask would be, are dogs that going for long but slow walks on a leash different from dogs that are sprinting off into the woods unrestricted, having bursts of energy versus a long drawn out activity duration. So that kind of time intensity variation going on there. So we wanted to check all those different variables and see if those were different as well. For the health conditions, we grouped them according to the body system. So there are 337 different conditions in the data set that dogs could potentially be diagnosed with, and we would group them. So, for example, something like cataracts, glaucoma, conjunctivitis, all of those belong to the eye. And so those would all just get grouped into eye health conditions. Things like deafness or ear infection, tonsillitis, rhinitis, all of those group into the ear, nose, throat region. And so those would all group together in that health condition category. And so we did have all of these different health condition categories for all the different body systems. So everything from skin to endocrine diseases to immune diseases, liver and pancreas, kidney, urinary, but also some that are not necessarily directly related to a system, but are more due to something outside. So, for example, infectious or parasitic diseases are one category. Toxin ingestion is a different category. And then trauma is a different category as well. So, like hit by car events, things like that. And so for our results, first we just looked at what is the participation in the dog aging project across all the different states and regions. And we found that that is not very equal. And so certain areas, like you'll see Washington, there's a lot more people, a lot more percentage of the population enrolled in Washington compared to, say, Mississippi. And so that could be for many different reasons. Don't entirely know why, but I mean, the dog aging project did start in Washington, so there's probably a good reason that that area is overrepresented. But for some of the other ones, it's kind of like, whoa, I wonder why people in Georgia versus Maine didn't enroll their dogs as much. Don't know, but it's interesting and it's important to understand that, to know what areas are being underrepresented by this particular data set. Now, weather definitely varied by region, and I think people feel this feel this for sure. So, the number of hot weather months in the South was reported to be far more compared to, the number of cold weather months, and then the number of moderate weather months. So, like the West reported the highest number of moderate weather months compared to any of the other regions. And I was just thinking about it, in terms of, we'll get to it later, but with activity, because I'm thinking for some people living in certain regions, like in the South, like sometimes it just gets so hot, or conversely, the opposite of that. Maybe it's so cold that you're like, I just can't go out and exercise my dog today. Like it's too extreme a temperature. And so I was wondering if that did have an effect on the activities of the dogs. Now, indoor air exposures did vary by region. And let me just orient everybody to what this chart over here is. It's a spider plot. And it's just a easier way to be able to look at a bunch of different variables all at the same time. And so the different colored lines represent the different regions. So like your Midwest is this navy blue, the Northeast is this purple, the West is orange. And so like for each bar of the spider plot, so like electric stove, for example, or here, let's talk about central AC, because I actually have a plot relative here. So for central AC, you can see that the West has relatively less. Central AC reported fewer dogs that are in central AC compared to, say, this teal color, which is the South. And you can see this is the same exact bar plot of that. And yes, the West versus the South. The West seems to have the lowest. The South has the highest percentage of dogs that are getting exposed to central AC. Um, but it's easier to kind of just show that really quickly on the plot so you can pull out, okay, what are regions that are really, really different from each other? So you can see like, okay, central AC, orange is lowest. Okay, that's the west region versus window AC. We've got purple here, that's the northeast. They seem to be over represented compared to the other regions. So that's the percentage of dogs that are being exposed in the northeast to window AC is much higher. Um, versus like it looks like natural gas cooking stoves are relatively lowest in the South, versus it looks like that's being made up for with the South having the most electric stoves. The outdoor contact exposures did vary by region as well. And so these are some of the ones that varied the most. Seasonal weed treatment. Let's see, seasonal weed treatment in the Midwest was apparently the highest compared to all the other regions. And then it was lowest in the West versus year-round pest treatment in the South was definitely the highest. So you can see the South needed people reporting the most year-round pest treatment for their yards. And then sand and astroturf were most common in the South in terms of the sort of contact exposures that dogs are having when they go outside. Water exposures, both indoor and outdoor, varied. So if we're talking about the indoor exposures, like what type of drinking water, what sort of pipes are in your house. So plastic pipes were most common in the South. So plastic piping for houses versus metal pipes were most common in the Northeast and in the West. Dogs swimming in pools was most common in the South compared to the other regions, versus swimming in a pond was most common in the Midwest. And then my favorite one of these is the ocean swimming. So if you look at the Midwest here, like the Midwest has absolutely zero dogs that are swimming in the ocean, or well, not absolutely zero, but extremely few. Almost 0% of dogs in the Midwest are being exposed to the ocean. And that makes sense. All of the other regions have some sort of coastline versus the Midwest doesn't. So perhaps that makes sense. Like dogs who want to swim are going to swim. It's just a question of where they're going to swim. All the other regions have exposure to a coast versus the Midwest dogs looks like they're trying to get into the ponds. So many of the indoor environmental exposures, I theorize, are probably related to the age of the house. So like the plastic pipes and central air sort of things are, varied a lot between the different regions, but so do the age of the house. So for example, the South has a lot more recent homes. If we look here on this chart, the South has a lot more homes that are built in the 1990s, 2000s, and 2010s compared to, say, the Northeast has an awful lot of homes that are built prior to the 1950s compared to the other regions. So, you're probably seeing a lot more of those like older construction things, metal pipes, being associated with the houses in the Northeast. But in spite of the extreme weather differences, exercise and activity exposures did not vary by region. So these were, now I had to pick certain things. So like the average, I picked the most common average daily hours of activity, the average walking activity, and then the overall activity. So just saying like, is your dog low active, moderately active, or extremely active? And basically this was exactly the same between the regions across all the dogs. Like these bars are overlapping each other. You can't even see all of them because of how close they all are. And so I thought that was really interesting because I was totally expecting there to be differences just based on how the weather is different. So, but apparently that's not true. Apparently dogs are going to be active regardless of how different the weather is. It probably just means that they're doing different types of activities. Looking at the health conditions, not all of them varied by region. Only 5 of them did, but here are the ones that did vary by region. And so This is the mouth, dental, oral group, the skin, the infectious parasitic diseases, toxins, and trauma. And so you can see that oral diseases were the most common in the West. Skin diseases were most common in the South. And so that did jive with my personal experience as a veterinarian. Versus infectious and parasitic diseases were by far the most common in the Northeast compared to any others. And that also jives with my personal experience as a vet. But, you know, it was interesting trying to go into these, just look into them just a little bit closer because, the infectious parasitic disease is being far more common in the Northeast. That was almost entirely explained by tick-borne diseases and then also Giardia, which is a gastrointestinal parasite. But when you go into the like mouth, dental, oral conditions, that one, it's not like there was one particular disease. It's not like dogs in the West were getting one particular diagnosis compared to the others. It was just, all of them were more common in the West. And I thought that that was very interesting. Same thing for toxin and trauma. Like, I don't, as a researcher, I do not have a good reason for why toxin and trauma diseases, diagnoses were far more common in the West compared to the other regions. And so overall, we can summarize this and say that yes, there are several differences in environmental exposures across the regions of the United States within the Dog Aging Project dogs. Some health conditions did vary by region, while others did not. And despite the large climate differences between regions, activity measures for dogs were not different. So I find that to be the most, kind of one of those things that went against what I thought was going to be when I went into the study. And so kind of bringing it all together, the dog aging cohort dogs could be used to study these different exposure differences and kind of determine what sort of exposures are leading to different types of health outcomes, like what exposures, like are air quality indicators important to respiratory diseases in dogs, those sort of questions. I think this does show that this is a good data set to ask those sort of questions. And if you think about dogs as being a sentinel for human exposures and diseases, that could be really, really valuable for that as well. And then, of course, specific regions, because of the work that we've done here, we've identified that certain regions may be more appropriate to study certain exposures compared to others. So like, for example, now this is a really obvious one, but the Midwestern dogs probably shouldn't be the group that you pick to study the exposures of ocean water on the health of dogs, right? Now that's a really obvious one, but there were other examples within this data set that perhaps may not have jumped out. Like if you're interested in studying the effect of central air conditioning versus others, you might pick different groups of dogs within the Dog Aging Project. And so I'd just like to say thank you for your attention, and also thank you to all of the Dog Aging Project participants. The data that we're able to study because of the time that you take every year to fill out all of those really, really, really lengthy surveys is extremely appreciated. And thank you so much.
All right, that concludes our August PAC event. Thank you, Dr. O'Brien, for being here and being part of our PAC event. We truly appreciate you taking the time and then sharing your amazing work. If anyone has any specific questions about her research, please email Dr. O'Brien, or you can email our Dog Aging Project team at team@dogagingproject.org, and we'll forward her those questions. As usual, for any general comments, concerns, you can email our team. And if you haven't already, go find us on social media, go follow us, go like us, and of course, share your awesome pictures. And last but not least, again, just a quick reminder, our triad cohort is looking for more participants. So if you know anybody who has an older dog, send her our way. All right, that concludes today's event. Thanks again for joining us, and we'll see you on the next one. Bye.